Shall I compare thee to a summer's day?
Dear colleagues, I welcome you all to this final webinar of the series of WONCA webinars. We really had great pleasure discussing on various topics ranging from women, complexities to palliative care, adolescence, equity, elderly, e-health, and mental health. Finally, we are here with our last webinar on this series on very important topic of environment. And I believe it's not going to be the last webinar because we are planning to come up with the next series of webinars in the next year. And so finally, I would like to thank all our panelists who took out time from their hectic working hours in COVID duties and took part in this webinar series, and also to all the attendees who took part in this series, either on Facebook or Zoom, and all the videos of these webinars are there on YouTube channel. And finally, we have got a message from our WONCA president, Dr. Donald Lee. So here goes the video. Thank you.
Good morning, afternoon, evening. Thank you for taking time during your busy schedule to attend the second series of WONCA webinars. Family doctors around the world have risen to the challenge of this awful pandemic. In the midst of the massively increased workload for family doctors, I'm proud of the level of support and collegiality displayed within and across our member organizations and from region to region. It is heartening indeed. Indeed, the COVID-19 pandemic is bringing a lot of changes to our professional and personal lives. We are slowly adapting to the use of technology to overcome barriers and challenges created by the pandemic. We are getting used to meet virtually and using the cyberspace like what we're doing now. Colleagues are disseminating scientific advice, clinical updates, reflective messages, and professional support through their social media links and connections. They're keeping in touch with each other regularly, like family members, relaying information, urging courage in these extraordinary times. I think all those who participated or listened in our various webinars held in June and July will agree they have been well received and appreciated by many family doctors around the world. I'm really looking forward to the next series of webinars, which will include presentations from our working party and special interest groups on health equity, women and family medicine, e-health, aging and health, complexities, mental health, palliative care, adolescent and young adults, as well as the environment. Before I hand it over to the convener of this webinar, I would like to say that unfortunately, this is a pandemic with an unknown endgame. I wish each and every one of our family doctors well during this time. Use the best advice available, work collaboratively with your teams, do the best you can for your patients. You should stand proud of your contributions in facing the world crisis. No one knows what will be ahead of us in the weeks, but everybody knows enough to understand that COVID-19 will test our capacities to be kind and generous, and to see beyond ourselves and our interests. Our task now is to bring the best of who we are and what we do to a world that is more complex and more confused than any of us would like it to be. May we all proceed with wisdom and grace. Thank you.
Hi, everyone. This is Enrique. I'm currently chairing the Working Party for the Environment. And I just wanted to thank everyone for participating and joining this webinar. And especially thank Peri and Pratyush and Dr. Harris that have been trying to set up this for all of us. So we'll be discussing the healthy recovery on the pandemic and on the many economic problems that we have faced around the globe. Eric, could you go to the next slide, please? So we will have, I will be presenting first, then Andry Haines, then Courtney Howard, Jacqueline Ponzo, and Kathy. They're all known to us, perhaps except from Kathy. Andy has been with the Working Party for a few decades now, helping found it. Courtney is a leader in Canada, and Jacqueline Ponzo is presiding the Ibero-American chapter of WONCA. So the first slide that you're seeing is just to talk about what does healthy recovery mean. So the World Health Organization has led with the Global Climate and Health Alliance a letter to the G20, that is the 20 countries with the highest national production monetary counted. And over 40 million health professionals have endorsed this. So this is a very powerful letter, basically saying that we have to put public health at the core of global recovery plans. Would you go to the next slide, please? This is a document, you see the link below, by WONCA. It was created by our working party with help from many experts, and WONCA endorsed that we officially recognize the climate emergency. So we need to understand how to tackle climate emergency while improving health during this pandemic. This is possible, and especially once we have tamed the pandemic, hopefully. Next slide, please. So our webinar is also within the context of the declaration calling for family doctors of the world to act on planetary health, which is also endorsed by WONCA and has had much impact around the globe. Jacqueline Ponzo here is also helping organize the next planetary health WONCA conference, which will happen in August 2021, along with the Brazilian National Conference and the Ibero-American Conference. So we hope it will be a very interesting time, and we hope to talk about a healthy recovery again. Next slide, please. So I pass now to Andry Haines that will speak to us again. Thank you. Andy, with you.
Thank you very much, Enrique, for the introduction and for welcoming us. So we are at an extraordinary point in human history where we have to think very clearly as we emerge, hopefully, from this COVID pandemic over coming months and years, about how to integrate health, economic recovery, and climate action into a holistic action agenda. Could I have the next slide, please? So the next slide was actually compiled a few months ago, and it shows you the impact of COVID, the COVID pandemic, on the economies. And you can see that it assumed that at that time that there would be a bounce back, there would be an improvement in the economies towards the end of the year. But of course, it's unclear to the extent to which that will now happen, because in many countries, lockdowns are starting again. So this slide actually may be too optimistic about the rapidity of the economic economic response and the economic recovery. But there is no doubt that we're moving in many countries into an economic recession, which will itself have profound impact on the health of patients and populations all around the world. Next slide, please. Of course, there have been some positive aspects of the pandemic. One of those is that many people have remarked that air pollution has declined in many parts of the world, not everywhere, but in many parts of the world. This is just one example. And you can see that the nitrogen dioxide levels in the troposphere, the lower atmosphere, have declined quite substantially across India. And many people have remarked that they're now able to see the Himalayas from many, many kilometers away that they haven't been able to do for many decades. So this reduction in air pollution, some people have said, well, it's a good thing. It shows us that we can rapidly decarbonize the economy. But my response to that would be that COVID, that a rapid reduction in emissions that destroys the economy is not the way to decarbonize it. Actually, it's a lesson that we need to plan decarbonization of our economy in order to reduce the adverse effects on our patients, on populations more generally, and to stop these dramatic job losses and impoverishment of millions and perhaps billions of people. So it is a wake-up call. It's not the way to decarbonize the economy, but it does show us that we need to prepare and we need to implement actions rapidly if we are to decarbonize the economy in a safe and equitable way. Next slide, please. So this slide shows you the post-COVID-19 fossil fuel related carbon dioxide emissions by sector. And you can see that some of the reasons for the decline in emissions were because of reduction in transport, surface transport, aviation, industry, power demands, of course, much less so for residential use, as you'd expect, many people spending more time at home. The first decline, that first bump you can see in February, March, of course, is the Chinese economy, as the pandemic hit China first. And then the second one, of course, is the many Western countries. And the current situation, of course, is not on this slide because it's a few months old and things are moving very quickly. But I would envisage that in many parts of the world, carbon dioxide emissions are still well down on what they would have been otherwise. But unfortunately, these reductions in CO2 emissions will not really translate into much of a reduction in temperature at all, because they will not be sustained under current pathways. And also, when you rapidly reduce CO2, you stop burning fossil fuels very quickly, you also reduce some of the cooling aerosols, like sulfates, for example, which help to offset some of the reduction in heating. So it's a complex situation, but we can't say that COVID-19 will necessarily, by itself, help us to achieve a low or zero carbon economy. We need to follow up these declines with policies that enable us to emerge from COVID on a low or zero carbon trajectory as far as that's possible. Next slide. So I don't need to say very much about the relationship between rising temperatures and rising risks. They're summarized in this slide, which some of you will be familiar with, from the IPCC 1.5 degree report. You can see that as we move towards 2 degrees, the risks increase. Many of those are directly or indirectly related to human health, like coastal flooding, threatened ecosystems, extreme weather events, the potential for ice sheet collapse and increased sea level, heat-related morbidity and mortality, and reductions in crop yields. So many of these adverse effects, of course, then will have major impacts on our health and on the health of our patients. And of course, at the moment, we're not on a trajectory to stay at 2 degrees. If all the aspirations and the commitments made in the Paris Agreement are implemented, then we're on a trajectory for over 3 degrees centigrade, something of that order, which would be very dangerous, potentially disastrous for human society. So there's much more that we need to do to decarbonize the economy. Next slide. And this slide just reminds us of the urgency of the situation. If you take that 2 degrees centigrade line around the 50% probability, come to 28.4 years. That reminds us that we have less than 30 years of emissions left if we want to stay below 2 degrees, 50% probability, and 1.5 degrees, where we're almost out of time, it's less than 10 years. And as we've already heard from Enrique, the urgency of the situation was fully recognized by professional leaders representing 40 million health professionals who have urged the G20 leaders of the G20 nations to really ensure that public health climate action is embedded at the heart of the COVID recovery. So this is an unprecedented call from the world's health professionals. Next slide. WHO issued its manifesto for a healthy and green recovery, in which they proposed 6 steps that could be taken. Protecting and preserving the source of human health, which of course is nature. Nature including not just ecosystems, but also the earth systems, the climate system, and so on. Investing in essential services, because there are many people that have not reaped the benefits of the exploitation of fossil fuels, which has really powered the prosperity that many people in the world have experienced. And so investing in essential services from water, sanitation to clean energy, including in healthcare facilities, is vital. Ensuring a quick and healthy energy transition from polluting energy to zero pollution, renewable, zero carbon energy. Promoting healthy and sustainable food systems, building healthy and livable cities, and stop using our money, the taxpayers' money, to fund pollution, because still far too much of it is subsidizing pollution. Next slide. And nature-based solutions, some examples, we're increasingly recognizing that by protecting nature, we can also improve human health. For example, reforestation or forest protection can decrease malaria transmission, reduce air pollution, reduce diarrheal disease. Protecting mangroves can reduce coastal flooding, and protecting watersheds can safeguard healthy, clean water for many cities around the world. So there's a lot of potential win-win strategies, protecting nature and protecting human health with well-designed strategies. Next slide. Phasing out fossil fuel burning will prevent many premature deaths. Recent estimate we had was about 3.6 million deaths annually, something of that order. And the distribution of them is shown on this map. You can see many of them in Asia, in Europe, North America, and to a lesser extent other parts of the world, depending on how much fossil fuels they actually burn. So when we reduce fossil fuel burning, we not only reduce climate risks, we also bring near-term benefits from reduction in air pollution-related mortality, including from heart disease, lung disease, and many other conditions, as we're increasingly finding out. Next slide, please. We also know there's a lot that cities can do, and primary care practitioners can work with urban decision makers to ensure better access to efficient public transport and active travel like walking and cycling, which brings the benefits of physical activity as well as reduced air pollution. Universal access to clean, low carbon energy, which can reduce not only ambient or outdoor air pollution, but also household air pollution. And of course, in many parts of the world, household air pollution is a major killer caused by the burning of solid fuels. Safe access to green spaces that I've already mentioned as an important, can importantly improve health, both physical and mental health, particularly access to green space in cities, for example. And of course, housing improvements, water and sanitation as well. Next slide, please. Food systems, we don't have time to go into detail, but I think everyone knows that food systems are a major driver of environmental change, responsible for about 1/4 of greenhouse gas emissions and much of the biodiversity loss, and also pollution, of course, is caused by a dysfunctional food system. Over 800 million people suffering from undernutrition, lacking inadequate food, and over 2 billion suffering from overweight or obesity. So truly dysfunctional food system, which is also damaging the environment. And the Eat Lancet Commission pointed out, if we all move towards this planetary health diet with more fruit and vegetable consumption, more whole grain fibers, less red meat, more nuts and seeds, then we could all be healthier, but also could dramatically reduce the environmental footprint of the food system, potentially preventing 10 to 11 million premature adult deaths per year by 2050. Next slide. And then finally, the healthcare system. Of course, we're now increasingly recognizing that our own system, the healthcare system, is a major driver of climate change. If it was a country, it would be the 5th largest emitter on the planet. Recently, we've seen a few health systems, particularly NHS England, for example, committing to net zero by 2040 for those direct emissions from health facilities, shown in the right side of the slide. directly from healthcare facilities, and by 2045 for the indirect emissions, so the electricity that they purchase in, the embodied energy and carbon dioxide emissions in medical devices, in pharmaceuticals, travel and transport, and so on. So this is an ambitious plan to decarbonize the healthcare sector. And of course, one of the best ways of doing that is to move towards more prevention and away from energy and hungry and intensive hospital care to more emphasis on primary care, which is very much, of course, the focus of those of us in WONCA. Next slide, please. And finally, there's growing public support for a healthy, climate-friendly recovery. Recent report, well, actually a few months ago now, from Mori Ipsos has shown that even in countries where there's quite a high level of climate change skepticism, like for example, Australia or the US, there is majority support for a climate-friendly recovery. So as we emerge from COVID, we should be spending our money on stimulating and incentivizing a zero carbon development. And we will have public support for doing that. Next slide. So how climate friendly is the post-COVID stimulus? Well, at the moment, major governments around the world have committed about $12 trillion, vast amounts of money to the post-COVID stimulus. A recent paper in Science and analysis by a group called Vivid Economics have shown us that only a minority of those stimulus packages are actually climate friendly. The European Commission, France, UK, Germany seem to be generally climate positive, so they're investing more on renewables and energy efficiency and other strategies and policies, technologies that reduce emissions. But most other countries are weighting their investments very heavily into negative contributions. So in other words, investments in fossil fuels or policies and industries that will actually increase greenhouse gas emissions. So most countries are not taking this opportunity to invest in a climate-friendly, health-friendly post-COVID stimulus. So the problem is not lack of money, there's lots of money available. It's the political will that's lacking to invest it in the appropriate things. Next slide. So there are many ways to promote a green, healthy and just recovery. We'll discuss those later. Obviously removing subsidies. We subsidize fossil fuel at least 400 billion, more if you're including the unpaid externalities. Clean energy prices are increasingly competitive, but of course many countries still subsidize dirty energy, and setting prices at fully efficient levels would be very good for our health and would also reduce global CO2 emissions. And when we recapitalize companies, and they will need recapitalization because of this economic impact, then we should do so according not to just economic criteria, but also based on environmental and health criteria. In that way, we can secure both improvements in health, the climate, and the economy. Next slide. So finally, let me conclude by saying there's a real opportunity now to achieve a healthy zero carbon economy through a number of initiatives. This is just one of them. It's the Race to Zero initiative, which has been endorsed by over 1,000 businesses, 450 cities, 45 big investors, 500 plus universities, and 120 countries, the largest ever alliance, which is committed to achieving net zero carbon emissions by 2050 at the latest. And I think the health professions have a very important voice in this alliance by making the case for holistic investment and political strategies which encompass health and the environment and economic sustainability. So I'll stop there and hand over to colleagues. Thank you very much.
Thanks, Andy. I think Jacqueline will go on now. Please, Jacqueline.
Hello, thank you. I have some minutes for share bioethics, health, and environmental since Latin American perspective. The next slide, please. This is picture from Porto Alegre, where Mina Guaíba is a very dangerous problems at this moment. The pandemic don't stop the advance of the destroyed in our region. The next slide, please. This slide is from Porto Alegre too, and the women are a very important population, very important group in the mobilization, in the meeting for stop the progress. Next slide, please. I would like to share this perspective from Victor Penchasadek. Victor is a family doctor from Argentina, genetic and bioethicist. He said, the extractivist and predatory economy that expands in Latin America has correlated the degradation of the environmental living conditions and mass migrations in search of better opportunities. These migrations in turn generate ethical challenges of the first magnitude by the banishment that they imply the breakdown of family ties, poor reception in host countries, and stigmatization and violence against migrants. Next slide, please. I think all of us know very good the Universal Declaration of Human Rights, but I think a lot of us, a lot of people don't know a Universal Declaration of Bioethics and Human Rights. This very important declaration is from 2005 from UNESCO. And we're going to share some topics from this document. The next slide, please. Recognizing the ethical issues raised by the rapid advances in science and the technological applications should be examined with the respect to the dignity of the human person and universal respect for and observance of human rights and fundamental freedoms. So, next slide, please. Recalling the Universal Declaration of Human Rights from 1948, the Universal Declaration of Human Genome and Human Rights adopted from 1997, the International Declaration of Human Genetic Data from 2003. Next slide, please. And the others, declarations, protocols, and normatives for research, Helsinki, World Medical Association, and others that you know very well. Next slide, please. Stressing the need to reinforce international cooperation in the field of bioethics, taking into account in particular the special needs of developing countries, indigenous communities, and vulnerable populations. Next, please. The International Declaration of Bioethics and Human Rights put in the first point, the declaration addresses ethical issues related to medicine, life science, and associated technologies as applied to human beings, taking into account their social, legal, and environmental dimensions. Next slide, please. In progress, respect of human vulnerability and personal integrity, say, enabling and advancing scientific knowledge, medical practice and associated technologies, human vulnerability should be taken into account. Individuals and groups of special vulnerability should be protected and the personal integrity of such individual respect. Next slide, please. And this very important article put the environmental and biosphere and biodiversity in the core of the declaration. The regard is to be given to the interconnection between human beings and other forms of life, to the importance of appropriate access and utilization of biological and genetic resources, to respect for traditional knowledge and the role of human beings in the protection of environmental, biosphere, and biodiversity. Next slide, please. This declaration adds to the human rights some important topics, issues listed in these slides. The right to respect for personal autonomy, the right to respect for personal integrity, the right to the enjoyment, the highest level of health, the right to quality health care, the right to access to medicine, the right to adequate food, the right to access to drinking water, the right to cover basic needs, poverty reduction, the right to literacy, the right to enjoy the results of the research, the right to an uncontaminated environment. So, the health is a bioethic problem, bioethic need, with pandemic and without pandemic. But in pandemic, this problem is same or more before the pandemic. And our planet, our health, our life is the same. Bioethics is ethics of life, and we need it. This is our message from Latin America. Thank you so much.
Jacqueline, thank you very much. Very important to have this look at the ethics of life. Courtney, please, can you join us?
Great, thank you. Thanks so much, Enrique. Can we advance to the next slide? Of course, I'm like actually on the wrong screen here. So as we contemplate making the change that we know we need to make in the world, it's daunting. And one of the reasons it's daunting is that as family docs in most countries, we're not really taught how to create change in the world. We're taught how to advocate for our patients. And we're taught if we come in with some degree of potential political activity prior, sometimes we have some skill in that area, but in many cases we don't. And so people will say, having done this for a while, people, and as many of you have, people will say, well, why are you taking action outside of the hospital? And this is a diagram that I often use to help people understand this. So in fact, can we go back one slide there? So I often refer to this as a planetary health nest. And what's good about this is you can actually explain it with your hands if you want to. So I'll be on Zoom calls and I'll say, hey, well, this is how I think about planetary health. And so we think about the ecological determinants like the structure of the nest, the twigs and the robust part that holds everything up. And so if that's stable, if the climate, if the soil, if the water are all operating, that gives us a stable platform upon which we can build our society. So we can build a social system, political system, economic systems. Next slide, please. And those give rise to the social and structural determinants of health. So things like income and education and housing. And if that's all going really well, and we have a lot of focused resource and capability, we can build the very complex structure that is a hospital. Next slide. Or a healthcare system. And what's important to know is that, depending on which study you're looking at across countries, only contributes between about 5 to 25% of overall health status. And I think it's very important to just point out, the reason I like to present it like this is because it makes very clear that our ability to even have that healthcare system is dependent upon the stable ecological foundation underneath. And so not only do the ecological determinants have a direct link to our health, but in fact, they support our ability to have a healthcare system. Next slide. And so this is how I will often explain planetary health to my colleagues. And, you know, I've sat around a lot of board tables over the last many years, and people will say, stop talking about climate change. It's only one thing. And I'm like, no, no, no. It is the underpinning of everything we do. Everything we do depends on a stable climate. And that I find that when I explain it that way, and you can say, if you've made your nest, you can say, everything we do depends on a stable foundation. Once your foundation is rocky, everything goes, and people understand. So this is one of the best ways I've found to on the go explain planetary health to people. And it has, I think, helped me out sometimes making an argument around a board table or in other places, because the reality is that many of our colleagues don't know what they don't know about planetary health, and you only get 2 minutes to talk in any given sort of situation. And so you have to be able to explain it really quickly. And this is the way I've been doing it, and it seems to work. Next slide. And so once you've sort of explained the spectrum of planetary health and why we as docs need to care, we move then into, okay, well, what do you want to do? And I think for a long time, we've had an unconscious model of change that has relied on us filling deficits in information. So an information deficit model of change. I, as a new advocate, I was new to the board of the Canadian Association of Physicians for the Environment. And actually, I just read one of Andy's papers up in Inuvik, so north of 60, where it's already 3 degrees Celsius warmer than it was when an 80-year-old elder is born. And I was very motivated. And so I joined the Cape board, and I came in, and at the time they were working on pesticides, and I wanted to work on climate change. And I said, hey, let's work on climate change. And the executive director, who's a very experienced environmental campaigner, said, well, what's your target? And I said, we need to work on climate change. And he said, well, what's your target, Courtney? I'm like, we just need to solve the things. And he said, you need a target. And at the time, I thought he was just being obstreperous because he wanted to keep working on chemicals. But he turned out to be absolutely right. So like so many other things in life, if you want to change something, you really do have to figure out exactly what it is that you want to change, and then make a plan with your team to change exactly that one thing. And so I think about targets now as being at various levels. So a micro level target, sort of an individual level change, or a change that somebody will make, in their practice, maybe prescribing a Ventolin inhaler that is less bad for the climate. A meso level change, so organizational or departmental level change, maybe you're going to try to eliminate really harmful anesthetic gases from your entire department. A macro level change, like a coal phase out type of initiative. And so what I'll advise people when they want to make change is to take a look at their resources and say, okay, well, how big's my team? How many people have I got? How much time have I got? How much money have I got? And choose your target based on your resources. And so there's no shortage of evidence-based targets. We've heard about many, Andy presented just now in terms of food security and decarbonizing our healthcare system, et cetera. And so the evidence-based targets are available. And so what you want to do is strategically choose your change-making target based on who you are, who you have access to, what decision is about to come up, how much media attention you think you can get, etc. And what a truth that we need to really accept, which is difficult for us to accept as people who really, have spent years studying the scientific method, is that numbers numb and stories stick. So as we're helping to convince people to change their behavior, the narrative is probably as important as the actual data that you are going to provide. And that's because humans make decisions. We get off the couch led by our heart much more than by our head, which we wish it weren't like that, but it is. So it's best to just accept it. And so when we can do that, I'll use the example of coal phase out because we've done a lot of that work here in Canada. So in the Canadian province of Ontario, so I would consider this a macro level target, about 15 years ago now, a coalition of homeowners and community members and healthcare practitioners wanted to reduce coal-fired power. And what they chose as a story was to talk about the local health impacts. So kids going to, missing school because of asthma, parents therefore, and also ending up needing to miss work, the amount of money that was costing the healthcare system, and the messengers that they chose to give that message were physicians. So there was an entire coalition of people who were working on this, but the person at the press conference was a doctor, often with a stethoscope, nurses, other healthcare practitioners. And so that provides a story to the media and to politicians about why we should change. And it was so resonant. And so in terms of tactics, those are things like a press conference, commissioning a report that allows you to have numbers to put to some of those story elements, etc. Those can, over the course of time, a variety of tactics, help you win your goal. And what I've learned is that that builds the movement much faster than anything I could potentially tell people. And it's almost, when you think about the way we learn medicine, we learn in a case-based format most of the time these days. And so this is essentially problem-based learning in planetary health and in advocacy, and people get really excited about it. So when I initially asked the Canadian Medical Association to divest from fossil fuels, I only had 2 people who were really talking about this in Canada. And then once I put that target before them, they all got kind of excited. And all of a sudden I was emailing 100 doctors across Canada, and that happened in about a month. And so we can see that some people are competitive. I find in particular health practitioners, doctors are really competitive. So if you can choose, and this is not intuitive, I used to think, okay, I'll make a small ask of them. I will ask them to, I don't know, eat meat once less a week or something. Oddly, sometimes it's better to ask something more ambitious, because if they can envision a meaningful change in the world, they get excited and they'll invest more of themselves in it. And what's great about that is once you win, you inject hope into the entire situation, and you create this feeling that Marshall Gans refers to as you can make a difference. And what that does is it builds your team. People get on the bandwagon, and then all of a sudden you have more resource to pick a more ambitious target the next time. And it kind of goes around iteratively like this. So as you're thinking about making the change in the world you'd like to see, really start thinking about what targets you can accomplish. And the more specific it is, the better. There's a table in the supplement to this paper that goes through some of the common ones with some examples. And I'm very happy to chat with anybody about this, because this sort of strategy is something I love. Next slide. And so think about the emotions that your story is generating. This again is from Marshall Gans, who's a movement researcher out of Harvard. And so he talks about emotions that inhibit action as being things like inertia. And so when you're generating your story, he talks about coming up with action motivators to counteract those other actions. So inertia can be overcome with a story that elicits urgency, apathy with anger, fear with hope, isolation with a sense of solidarity. And I think this is super, super important. So many advocates are very lonely. It's scary to be standing up in a room by yourself, saying something, delivering a message that people don't want to hear. So the more we can have initiatives like this to generate solidarity amongst ourselves, the better. And feeling of self-doubt can be overcome with a feeling of you can make a difference as you see case studies of other examples. So I really encourage people to tell the story of their wins. We need to hear those. You're not bragging, you're helping us. And so make sure you tell the story of your wins to the international community. Next slide, because it can really be iterative. First, we phased out coal in Ontario. That provided a case study that informed exactly how we went about phasing out coal in Alberta, which then provided a case study of how we phased out coal nationally, or got the commitment to phase out coal nationally. And then once this was done, and you can see my friend and the incoming president of CAPE, Dr. Joe Vipon, wearing scrubs on TV. Wear scrubs on TV. It's a costume that helps to represent who we are. It feels very odd, I must say. However, it works. We know exactly who he is and why he's there in that screenshot. And that's part of the storytelling. Next slide. And so because people, some of the good work done by Andy and others in the UK had generated a similar set of initiatives within the UK, our ministers of the environment got together and helped to fund and found the Powering Past Coal Alliance, which is now acting as a policy magnet for countries worldwide. And in fact, one of the last things I did before the world shut down was attend a presentation by a policy analyst in the UK, in Tavistock Square in BMA House, where he actually plot of coal policy pre and post the Powering Past Coal Alliance. And he showed that if this sort of quadrant was the desirable set of policies, after it was formed, people just started moving towards it. So we're social creatures. Examples matter, leadership matters. And so think about all of those elements as you're creating change, and make sure the more we communicate with one another, the greater sense of solidarity we'll have, the better ability we'll have to communicate our case studies and to generate that kind of momentum that will help us create a healthy future coming out of COVID. So thank you. And I just want to say that what Kathy is about to present, I think, is a really, really strong initiative that can help us to generate this kind of momentum.
Thank you, Courtney. I think we can go to Kathy. Kathy, thank you very much for joining us as a last-minute invitation. So please just go ahead.
Sure. Thank you very much for inviting me. Since I am new to this community, I'll just quickly say that I'm also a medical doctor. I graduated in Germany 2 years ago. Haven't specialized yet, but actually family medicine would probably be one of the specialties that I'd consider. And yeah, I'm pleased to share with the WONCA community this proposal for a new pledge for planetary health, which I feel ties in quite nicely with what Jacqueline has presented before about endorsing and enforcing bioethical principles worldwide. So this pledge, if you click on the next slide, is a proposal which I published in The Lancet together with a great international and interdisciplinary team of planetary health enthusiasts, including Courtney and Andy. And the idea to draft this pledge originated from my own experience at my graduation ceremony of reciting the Declaration of Geneva, together with, is based on the Declaration, which is, so to say, the Hippocratic Oath, but it goes beyond that oath in that it includes planetary health principles, and it is a pledge that is explicitly to be taken by all health professionals and not just by doctors. So how is it relevant for family doctors in particular? We write in this article, and it has been shown by various surveys before, that consistently health professionals are the figures in society who actually earn the most trust by society, much more than politicians or other people. And so in particular, family doctors who really sit in the communities can act as multipliers of change, as they are really probably the most effective communicators that we know. And so they can spark new thoughts in the people they interact with, disseminate knowledge, and potentially even trigger behavior changes and engagement in the people they talk about, they talk to. And how is it relevant for health recovery? Well, it adds a moral ethical dimension, maybe even a moral imperative to the discussion around what a healthy recovery should look like from a health professional's perspective, including principles of intergenerational equity, the precautionary principle, acknowledging and fighting bias and discrimination, equity and access to health, and so forth. And it is another tool of engaging people, of engaging other health professionals and beyond, to foster a sense of community in those who might be taking this pledge together or simply discuss it. And these are the kind of collective actions that could also help building the movement and getting some personal stories out there, as Courtney just said. And it could help to put these ethical principles at the core of any narrative around health recovery, as well as action for environmental protection and conservation at large. And that ethical narrative can also actually be employed on all the different levels of action, so from micro to macro, that Courtney mentioned before. And I'd like to acknowledge again that this pledge is a proposal, so it has a suggestive character. We know that we don't represent the health community worldwide, but we want to spark discussion, and we want to really get this pledge out there as an idea sparking tool, and we invite feedback, we invite comments, and we most of all invite people to use it, to take it in and use it in any discussion, to make up their own minds about it. What does it mean for their personal practice, and develop it further. And so, yeah, our vision is that these ideas are at the core of all health professionals, of practice, of all traditions of healing worldwide, that it sparks these discussion and thoughts, as I mentioned, around the question of what it means to do no harm in the Anthropocene for medical, nursing, and therapeutic practices and research, and beyond that also for our own political and social activities as health professionals. And that's it from me. Courtney and Andy, if you want to add to that, please do so. And thank you for having me here.
Thank you very much, Kathy. I think we still have 9 minutes to go, and I just want to invite you, Kathy, to join our working party at WONCA.
Thank you.
And try to adapt it to family doctors. And I'm starting to discuss this with my students, and I think it's a good way forward. I agree.
That's good. Thank you.
We have one question. So maybe I can read this. I thought maybe Courtney could start answering this, but I think in the panel, we can have people just comment on whichever speech they like. So I'll read Rick Botelho's question. So we have to go upstream to address the ethics of equity, to address the social political determinants of personal, population, planetary health. What about WONCA offering a community building, interactive learning netinar series to cultivate an equity leadership movement to design an inclusive, equitable, and sustainable future? So I'll just mention that our working party actually received a grant from WONCA to exactly develop a course on planetary health and climate change. And we're doing a train the trainers air pollution program from our working party on the environment. So I think Rick Botelho is right. We need to provide educational tools and so forth. But it's very good to have Courtney here. Courtney, would you like to comment on this, please?
Yeah, sure. I think that it's a great question and something that I think is important that we address. So when I first started doing this, and I don't know if Andy would feel the same way, but essentially there were so few people talking about climate change and the environment that we were sort of a very small community of people, and our message, therefore, I think was necessarily very, very focused on the ecological determinants of health. We were just sort of screaming quietly in the corner. And what we were ignoring, and I think it was sort of a function of the situation, were the social determinants of health and the inequities. And a couple of years ago, whether it was because the conversation changed or whether we achieved critical mass to the point where we felt like we could broaden the message, I think we have started to do a better job of incorporating work around the social determinants of health and inequities into the ecological health, planetary health conversation. And I think that it's really worthwhile for us to connect up those conversations, because when we look at the evidence around inequality, we know that, you know, inequality is essentially toxic to society as well as to individual humans. And it really makes it very, very difficult for us to create the change in the environmental space that we need to in order to see the change we want. And so I actually just this last summer did a much more reading than I'd ever previously done to figure out what the targets are around inequity, because I actually didn't really know what they were. Turns out a guaranteed basic income is a really, really key thing. So, you know, in terms of my goals, in terms of what I want to get accomplished in Canada over the next couple of years, a guaranteed basic income has like rocketed up to the top. There's really good evidence for it, increasingly good evidence. We're starting to see a cross-party consensus here in Canada. And I think that if we add the health voice at, you know, maximum volume, we could probably get that done. And that will help to protect our society against so many of the different changes that we're seeing moving forward. For me, it's also really important to make sure that the voices at tables of power start to reflect a greater degree of equity. I've sat at enough tables now to know that it matters who's sitting there, as well as there's a fair bit of evidence around having more women at tables actually increases the pro-social nature of the decisions that are made. So studies in the European Parliament and Canadian parliaments as well have shown that if there's a greater proportion of women at the table, we're more likely to pass policies that protect the environment and protect health. And so it matters who's at the table. So what kind of policies, what kind of programs are needed to reduce the systemic barriers for women or for other people, for people of color, for people in any different kind of underrepresented group to achieve tables of power. That can be mentorship, it can be funding. I learned this year that if you're in politics or trying to do politics, fundraising is tremendously important. It's probably, people care how much money you're making more than they care about what you're saying. And imagine trying to raise money as someone from a more marginalized group. So I do think that I think it's absolutely necessary that we address this as part of our work in the Working Party for the Environment. And maybe there are other working parties within WONCA that we ought to be connecting with in order to maximize the efficacy of our collective efforts.
Thanks, Courtney. Perry, could you please try to remove the slides from the screen? So perhaps we can have a gallery. Yes, thank you. Perhaps a gallery mode of the speakers. Rick Botelli actually suggested that. Thanks, Rick. So we have some other questions here. There's a very interesting one from Jose Miguel. So he's congratulating the Working Party on Safety and Family Medicine. And he's asking about, I think, the Working Party on Safety and Family Medicine regarding artificial intelligence and machine learning. What would be the impact on environmental health for the next few years? So perhaps if we have someone from the patient safety Working Party here and would like to comment, that would be interesting. There's another question from Jason. Many health outcomes are the remit of non-health entities, authorities and ministries which plan short-term. Any advice on how to portray health determinants to non-health workers? I actually have to say that Courtney's suggestion of nests or a nest is brilliant. I'm definitely going to adopt that. So I think perhaps you can mention that again, Courtney. I think that's a very good technique.
That diagram is in the supplement for that targeted change making for a healthy recovery publication that I mentioned. So you can go there, and if you're interested in the layered sort of version, I do find if I'm presenting, it helps to build it from the ground up. But as you're presenting orally, and I have actually presented that's how I start almost every presentation that way these days, whether I'm speaking with decision makers or community members, and people really understand it. Media interviews works really well. So if you get out your hands, everybody get out your little hands. Yeah, so you just have to make sure if you're on Zoom, you hold your hands up high enough that the little green dot on your computer, yeah, so that's the ecological determinants of health, the twigs. The very supportive structure for our society. And so I always mention climate, water, soil, etc. And if that's stable, then we can build the social and economic systems on top of it that allow us to build the complex structure that is a hospital. And I'll often like actually do what I'm doing right now. And then you can say, and if our foundation isn't stable, the rest of it will not thrive. And I do find that people understand that well. And I've often wondered, like, we could run a competition, have kids like build nests. I think there's a lot of ways that you could sort of make this sort of fun and artistic. So Jason, that's how I do this. And I've been told by people who are good at messaging that the determinants of health language is difficult. So to make sure that you're actually naming what they are, because people can then figure it out.
Excellent. Thanks, Courtney. There's a question on whether we will translate the pledge to Spanish or other languages. Kathy, would you like to quickly comment on that?
Yeah, sure. So this is what we're currently doing with my colleagues from the Planetary Health Alliance. So the other student campus ambassadors, I asked them to help with that as they're an international group, and we've got already a couple. And I think Spanish is among them, and I would also be able to share that directly if not. We are currently all site that will host the pledge together with all of these translations. So if you still have a couple of weeks time, probably it will still take, it will be out there, and I will make sure to share it with this group as well.
Yes, thanks. So we're over the hour already. Pratyush, can we still have more 15 minutes, or should we wrap up? Perhaps have Andy start the last impressions, and we head to the to finish.
Go on.
Yes. So perhaps Andy would like to make any remarks. I think we have good questions already.
Well, I think really, Enrique, just to reinforce what's already been said, I think that family doctors and their colleagues in primary care teams have such an important role, because they are, in a way, intermediaries between the healthcare system and the social and environmental determinants of health. And I think they can speak with much more clarity and authority about these interrelationships, even than some of our colleagues in public health, who are slightly separated from the day-to-day context with the patients and with the population. So I do believe that primary care and family doctors, obviously as very key parts of primary care, are going to be really influential in advancing this planetary health agenda. And when I started getting involved in climate change and health, we really focused on the threat posed by climate change and the potential catastrophic impacts, which obviously is correct. But we also know that just telling people that the future is going to be catastrophic does not motivate change. Actually, it motivates the opposite. And I think that it could even be contributing to populism, this feeling that it's all futile, so why not just... So I think it's potentially dangerous. And I think to come with the message that it's just catastrophic and it's a threat without offering potential solutions is potentially a very dangerous way forward. And we in family medicine are very used to dealing with very difficult situations on an individual level and community level as well. And I think when the situation gets difficult, when you have a patient, for example, who maybe doesn't have very long to live, you don't walk away. I mean, you continue with that and you do your best. And so it is with our planet. And I'm not saying that the planet doesn't have long. The planet has millennia ahead of it, no problem at all. But our society is under threat. And we have to move quickly over coming decades if we're going to stabilize the situation. And I think the insights that we have from family medicine, because we're also very interdisciplinary by our very nature, we do not just focus on biomedicine. We have to take into account other disciplines, everything from anthropology to, biostatistics, epidemiology, humanities. We are taught to be synthetic, together many different perspectives. And I think that's an enormous strength in an increasingly specialized and fragmented world. I do believe that primary care can bring humanity. It can bring the ability to synthesize new evidence. We're not frightened by the fact that we're not specialists in a particular area. We know we're not specialists, but we are quite used to taking on board new perspectives, integrating them into a more holistic response. So I just want to end by saying I think that primary care has very important insights to bring and can act as an intermediary between the healthcare system and other sectors. And it's so vitally important that we do find ways, as Courtney has so eloquently told us, so important to reach out to other communities and other sectors. Many people, in the transport, housing, energy sector don't realize that they, in fact, are health professionals. We need to tell them you're health professionals, just like we're health professionals, and you can do a great deal. Let's work together in establishing this broader vision of planetary health, which needs intersectoral action. And I think in closing, let me just mention very briefly a new initiative that we launched last week called the Pathfinder Initiative, which is funded by the Wellcome Trust and the Oak Foundation. And it's an international initiative, including a Lancet Commission, which aims to bring together case studies of actions to secure planetary health. So what actually happens when people try to put in place decarbonization strategies in different sectors? To what extent are there successes and failures, and what can we learn from those successes and failures? And we'll be having an open call for case studies, for evidence over coming months. And we're going to synthesize those and then put them out into the public domain so that we can all share that knowledge and encourage mutual learning. And I'm sure that family physicians and primary care more generally will be important voices amplifying the message from experiences, the diverse experiences around the world, which we are now beginning to see and we're beginning to learn from. Thank you very much.
Andy, would you like to quickly discuss artificial intelligence and
well, very quickly. I mean, just to say that I do agree. I mean, I'm one of those people that do agree that we need to not be uncritical about technology. We need to be critical about it, but we also need to embrace new technologies when they occur. And I think AI has a potential for good as well as a potential for bad, depending on how it's used. But I would say I think it's absolutely crucial for planetary health because we're dealing with such complex data here. And we can't always, individual humans can't always analyze it and make sense of it. So let me give you one example. We used to do systematic reviews, which is an attempt to synthesize all the evidence on a particular topic. It might be air pollution and health. It might be policies to decarbonize the economy in a healthy way, this kind of thing. Now, when you try to do it these days, it's overwhelming. You might get 100,000, hits. You can't possibly look at 100,000 articles. So we're now working with colleagues in Berlin, Jan Menks and his colleagues, to develop AI approaches that will train machine learning to pull out the papers that are really relevant, really important. And so then humans can look at those in much more detail and try to understand what the implications for policy and practice are. So that's one example. But I would also say the example of synthesizing evidence from multiple environmental indicators and integrating them with human health indicators. I think that's also an approach which artificial intelligence can help us with. So it is an area of active research, and I expect we'll have a lot more to report over coming months, years.
Thanks. let me just check whether we have other questions. Patty, perhaps you can help me with Facebook just to check if there are any other questions in Facebook. And Jacqueline, would you like to make other remarks?
With my bad English, I would like to remark that is important the territory and this perspective with the history and the situation, economical situation of the countries. And we need to depth our role with family physician, and we need to think the process that involvement the people with family physician and with the economy in our countries, because all of them are very engagement and LinkedIn. So, thank you.
Thank you very much, Jackie. And before we finish, I just wanted to say thank you to all the participants, all the attendees through Facebook and Zoom. Thank you very much to Andy, Courtney, Jackie, Kathy, and special thanks to Perry for being so kind, Harris and Pratyush who helped to set up this meeting. And finally, just to mention that I'm thinking of an image, perhaps Patty can help, with the hands of Courtney's nest to be the symbol of our WONCA Planetary Health Conference. Could you just go back to the slide before, Patty, just so that I don't miss anything? Yeah, so yeah, thank you very much for everyone that attended. This was an important series by WONCA, and I hope we have other experiences like that. Thank you very much.
Shall I compare thee to a summer's day?
Thou art more lovely and more temperate.
Rough winds do shake the darling buds of May.
Summer's lease hath all too short a date.
Sometime too hot the eye of heaven shines,
and often is his gold complexion dimmed.
And every fair from fair sometimes declines.
By chance, or nature's changing course untrimmed.
But thy eternal summer shall not fade, nor lose possession of that fair thou owest.
Nor shall death brag, thou wanderest in his shade. When in eternal lines to time thou growest.
So long as men can breathe, or eyes can see, so long lives this, and this gives life to thee.